From the American Neurological Association, I'm Adeline Goss. This is ANA Investigates. Would you get an implant in your brain to control your car or unlock your phone? If the idea makes you a little uncomfortable, that's the focus of today's show, the ethics of brain-computer interfaces and other kinds of neurotech. Dr. Karen Rommelfenger is a neuroscientist and neuroethicist at Emory University and director of the Institute of Neuroethics Think and Do Tank. She describes herself as a neurotech ethics strategist, working to ensure that ethical implications, like those around privacy, personhood, and identity, are considered in the development of new neurotech. She was interviewed by ANA Investigates producer Dr. Rohini Samaldrawar, assistant professor at the University of Pennsylvania. Here's Rohini.
Welcome, Karen. We are so excited to talk about this novel topic on the complexity of the bioethics in neurotechnology and brain-computer interface. You have such a unique and interesting line of work, so important to the current state of medicine and science.
Thanks for having me here, Rohini.
I actually wanted to start off by discussing some of the major neuroethical dilemmas we're facing now. But I have a burning question. Tell me about the spiders.
Sure. Part of my work with the International Brain Initiative was that we brought together all of the large-scale existing and emerging nationally funded brain research projects around the globe. And one of my key partners in crime was Sungjin Jeon, who is a researcher at the Korea Brain Research Institute, which is kind of like our NIH in Korea. It's a very exceptional neuroscience institute. And part of what they've brilliantly done is designed an interactive neurotechnology and neuroscience museum. So you can learn a little bit about the brain, very accessible. There's some interactive platforms. And one of the interactive pieces is wearing an EEG headset and experiencing what it's like to try to control robot spiders, to move them back and forth through your focused concentration. And actually, it was quite difficult. And it was a really important exercise because, part of the sci-fi allure is that somehow we'll be able to just control things with our mind. And I resist that term mind because it has so much embedded in it and it means different things across different cultures. But the idea that you could control something that's why I said focusing on it, is actually quite difficult. And so it's not that we're going to be able to suddenly control things very easily with these devices, nor is it likely that it's going to be really easy for our thoughts to be read, which involves right now even clinical applications of implanted technologies require deep concentration and focus over years with a team and all kinds of training. So I don't fear really this future of mind reading and mind control in the ways that is portrayed perhaps in really interesting sci-fi writings.
Thank you so much for sharing that story. That really dispels some of the hype and perhaps non-realistic fears surrounding, quote, mind-controlling technology. Okay, now on a more serious note. With the rapid development of tech companies creating commercial, sometimes invasive BCI products as a means to control everyday tasks, provide entertainment, and perhaps record information, it feels that what we see in sci-fi movies has very much become a reality. This, of course, brings about a great deal of apprehension for neurologists and neuroscientists alike. Can you talk about the major ethical questions that arise with brain-computer interface technology here?
Sure. So there are a lot of exciting developments with neurotechnology. And I suppose the most sci-fi tech to me are actually in the more clinical research realm, like decoding words people are trying to say by recording from parts of the brain, mapping from onto vocalization, like with Eddie Chang at a UCSF, or having emotional range and essentially aspects of identity changed for the better with implanted electrodes for intractable depression, like Helen Mayberg out of Mount Sinai is doing. But one of the challenges is that it can be very hard for a person to know the difference between what is exciting developments versus what is hype. And I think that's where often scientists and clinicians can play an important role in finding ways to engage the public about technology and science developments. So I'll go now into the commercial space where there's a lot of rapid development. And much of that is owed to efforts to make clinical technologies smaller and less invasive for clinical applications. So instead of having to implant an electrode maybe it could be injected or inhaled and then combined with an external focused ultrasound device. And as these things happen, they make technology more accessible and possibly able to be applied to more consumer applications. But for now, the majority of consumer devices are sensing devices rather than stimulation devices. So there's a whole different suite of ethical issues for simply sensing devices. So for wearable technologies that are sensing technologies, these are related to consumer grade wearable headsets, inner ear devices, inner ear EEGs. These are being used to evaluate future of work, to augment K through 12 education, or for recreation like gaming. And my larger concern around these technologies is around whether or not these technologies are truly empowering the end user or if they're tilting more towards being exploitative. And the ways that they would be as exploitative via the kinds of data that are being collected and the data pathways that those data are flowing through. And it's not just the brain data alone that I'm really worried about that are being collected from these devices, because all of these more consumer ready devices are being linked to a larger Internet of Things ecosystem where we've already become accustomed to giving away a lot of information. So AR, VR devices, watches, and smartphones that collect biometric information, and even smart homes where people utilize an Alexa. As I've worked with policy scholars and analysts and intergovernmental organizations, we've also learned that there's a lot of gaps in regulatory protections for these kinds of data, particularly around inferences made from them, such as potential predisposition for particular behaviors or diseases. And you can imagine that you wouldn't want your employer to have data that suggests you might develop early onset dementia or decide not to give you a longer term contract because it's indicated that you might have a cognitive decline early on. So again, in the non-medical consumer space, some of my top concerns are really related to this violation of privacy and the potential stigma attached to this. And this can happen regardless of whether the technology is really working or not. It's just if people believe that information can be inferred from those data.
I'm wondering if there is a role for the clinician in development and use of these technologies. Do we as practitioners have a responsibility in this environment as well?
Yeah, I think the clinician's role is really critical in this conversation and with developing technologies, as they're often the gatekeepers to new technologies and interventions for patients. So there are many lived experience advocacy groups who do connect with clinicians and technology developers and policy entities and even medical organizations to help set codes and allow for insurability of certain technologies. And I think one of the challenges for the clinician also is that we've seen increasingly over the years that the consumer population or consumers of healthcare are eager to take healthcare into their own hands. It's not just looking up self-diagnoses now, but it's also trying to assess via their own instruments that they can buy. And companies that were never really intended to be healthcare companies are now offering that as a service. For example, Apple has Apple Health on its own. Amazon is becoming a health organization. Walmart will become a health organization. So a clinician will need to be able to navigate a consumer's consuming of these different types of healthcare services via these different technologies, not just neurotechnologies, but also the many other technologies where a lot of information is being collected on them to paint a pretty holistic picture of how they live. I don't envy clinicians because they already have to navigate a really complicated and evolving healthcare infrastructure, and this will only further complicate things.
You touched on an interesting point there about the amount of information that clinicians and scientists have to balance, especially when it comes to patient interaction. Are there resources that neurologists or neuroscientists can use to inform themselves better about these sort of technologies and perhaps how it can help our patients and the people we interact with?
I think there are some resources, but there could be more. So certainly there's our annual society meeting, the International Neuroethics Society meeting. And that has been a meeting historically that has been led by a board, including neurologists, including other kinds of practicing clinicians, ethicists, lawyers, legal scholars, really philosophers, a diverse set of people. So that as a professional society is a place that often offers certainly an annual conference to give certain updates on the state of the field, types of issues we should be scanning the horizon for, and a few resources. There's also the Dana Foundation, who has a great website where they're trying to offer resources, not just for clinicians, but for a general public, which might be a good resource to send patients to as well. But I think that we really need more for a variety of specific contexts. And so the way that needs to start is really through education. So there are only a handful of universities that even have a specialized neuroethics program. Ours at Emory was just one of a handful in the US. So I think we do need to work harder to install an infrastructure within universities that really help people understand the state of the technology, the state of the issues, and also the myriad policy implications of these technologies. We also have to do a little bit of damage control. The typical click-based ethics certification that many of us have had to toil through has really ruined ethics for a lot of researchers. And I certainly, even in my scientific training, didn't find it effective. So ethics there is basically the lowest bar, which is compliance. So it's seen as a compliance tool, not one that demonstrates that ethics is part of a larger toolkit that can support creative problem solving and also understand how to look better ahead and how to make decisions more impactful.
I want to switch gears a little bit to our recent ANA conference. There we had a significant amount of research discussed using brain organoids. And this was actually one of our plenary sessions. Several research initiatives support the use of organoids to advance our understanding of pathology and drive development of therapy. Should we take into consideration the same neuroethical concepts here as well?
Yes, absolutely. There are a lot of neuroethical issues that are currently being explored related to brain organoids. So brain organoids, which are 3D aggregates of brain cells, they're sometimes called mini brains, and nobody should be using that term. So I just wanted to put that out there. But people should know that they're really small, maybe 4 square millimeters in size. But even that little tiny package has a world of opportunity for research and development of novel treatments. And some, though, of these preparations have actually developed, as you maybe heard at your conference, spontaneous electrical activity that resembles the activity of brains from premature human babies. So there is a whole world of ethical issues related to the preciousness of those organoids. So how might we morally regard those brain organoids compared to, say, a lung organoid? And how would I know if a neural organoid developed a type of sensing, not even necessarily sentience, but a type of sensing that would make us need to change how we interacted with it? So if it developed a certain kind of sensing, could I just put bleach on it and throw it away? And if we implant these organoids into other non-human animals, in particular into parts of the brain related to higher cognitive function, and let's say we see an augmentation of cognitive function in that non-human animal, does that change how we should consider experimenting with that non-human animal and the ways we should interact with it? So we also know that this has implications for those who even donate tissue for these studies. We know that some people who have learned about the spontaneous electrical activity that can develop in these brain organoids have actually declined donating tissue in research when this kind of information was included in the consent form. So there are issues to consider here around what the status of those little pieces of tissue should be, how we should treat them, where we should start to circumscribe boundaries, if any, and also importantly, how people who donate that tissue feel about the way that tissue should be used and the legacies of that tissue. And it does feel a little different because it's brain tissue.
I will definitely be cognizant not to refer to them as mini brains. I have heard that before as well. Thank you so much for going into that, because it's a whole aspect, I think a new aspect for many that we haven't considered, especially with regards to neuroethics. What I have noticed about your work is the unique vantage point on how neuroethics can and should actually extend the benefits of neurotechnology for society. Can you describe how this can be the case and how your work has perhaps displayed that with companies you've worked with? Can this actually advance healthcare equity and inclusion within the neurotechnology space?
Thanks for asking that. And one of the things I didn't get to mention, because we've been focusing a little bit on newer technologies, is that there are older technologies that we should be considering with a neuroethical lens. And some of them are hiding in plain sight. So you and many of the listeners are no doubt familiar with EEG, which is now ubiquitous. Yet even 100 years into its use, the typical EEG records significant noise when reading signals from scalps that grow thick and curly hair, as in populations of African descent. So how has it come to this? How have we been using this tool so much in so many different contexts and still haven't optimized it for a global majority? So a more neuroethically informed lens could have highlighted the intersection of this ethical and technical challenge earlier. So this could have highlighted the blind spots, the bias of the unspoken assumptions that were used in the design of this technology, the status quo that we've come to accept with the state of the art, and with the interpretations of this data. And it was only recently that this neuroethics lens was utilized by researcher Arnel Etienne and colleagues to create relatively simple solutions with hair braiding and adding a simple clip that dramatically improved the EEG signal. And that's just one example. That's not even within a company, that's within academia. As I moved more into a practitioner space and thought about strategy, I've also been thinking a lot more about how to integrate ethical considerations and design constructs into the entire research to translation lifecycle. So can we come up with more impactful research questions? Even with that EEG that I mentioned, could we have considered who this technology was being designed for and who was being excluded in the process when we were designing it? And then also another thing is, can we create better design and user experiences with these technologies? Even for technologies that are perhaps implanted, ones that we might worry unintentionally or in an unwanted ways alter, let's say, parts of personality or ways that we're feeling. Can you install an override button? Is there a way to have certain checkpoints built into that technology? And then there are other kinds of practical tools. Can you develop ways to prevent misuse of technology? So a lot of people say, well, I can't see around the corner. If I don't do something bad, someone else will. Well, people developing the technology, people using those technologies, whether they're scientists or they're clinicians, seeing how this is used in the real world, there are ways to get that information and distill it into a practical tool, such as through contracts, designing acceptable use policies that make sure that people that use that technology can't use it in the listed ways that you can foresee might violate certain kinds of rights or interests of the end user.
No doubt I and many have come across the challenges with EEG leads, and it really helps put the utility of neuroethics into context for our everyday work life. What would you say is the most exciting aspect of neuroethics now, and where are the opportunity for us as clinicians and researchers at this moment in time?
I think neuroethics is really only getting more exciting. And I think the exciting aspect for me is that as awareness raises, we can get more and more voices into the conversation to creatively think about the world we want to design. So I'm really dedicated to advancing ethical neurotechnology that can reach everyone. And if we want to do that, we need as many voices in the picture as possible. We need representation across many dimensions, horizontal and vertical in organizations, race, ethnicity, geography. We really need that to be able to solve these types of problems. And clinicians and researchers are a really important part of that puzzle.
Thank you so much. This is such a great call to action, as you say, for neurologists and neuroscientists alike. Our discussions spanned quite a bit, and I could probably continue talking to you for much longer, but we covered so much ground, I think, from consumer tech to the very real applications for all of us. We really appreciate the time that you took with us today.
Thanks for having me.
That was Dr. Karen Rommelfanger, director of the Institute of Neuroethics Think and Do Tank, interviewed by Dr. Rohini Samudrawar, assistant professor at the University of Pennsylvania. You can listen to past episodes of ANA Investigates or pitch an idea for a future podcast at myana.org. That's it for ANA Investigates. I'm Adeline Goss. See you next month.
This has been an episode of ANA Investigates, the official podcast of the American Neurological Association, and an ANA Education Innovation Subcommittee production. Thanks for joining us. To learn more about today's program and to find out about the benefits available to ANA members, including access to an array of educational programs and resources, please visit myana.org. Dr. Adeline Goss is our host and the executive producer of the show. Episode producers are members of the ANA Education Innovation Subcommittee, chaired by Drs. Megan Ritchie and Romer Giaccaden. This is your logistics coordinator, Jen Hurley. Copyright, the American Neurological Association.